Welcome to the 2022 annual community briefing for the Hazelwood Health Study. I'm Michael Abramson from Monash University. I'm the principal investigator of the Hazelwood Health Study. The next speaker probably needs no introduction. Matthew Carroll from the School of Rural Health at Monash leads the stream investigating psychological impact. So I'll hand back to Matthew for a live presentation.
Thank you, Michael. So this year's actually been a fairly intense year for the psychological impact stream because there's been a lot of data collection. We've had two surveys running almost at the same time. We started the year about 3 months ago. We started a collaboration with the early life follow-up stream where we actually sent a survey out to all of the participating families, and we're wanting to look at the relationship between parent and child mental health and where that sits in terms of level of exposure to the mindfire. So we were quite pleased. We got over half the cohort did the survey for us, and that's some people who had their last interaction with health was back in about 2016. So they've been invited to various health parties and so on, but may not have actively been involved in research for 5 or 6 years. So we were quite pleased with the result of that. We stopped that survey about a month ago. We're literally just starting to look at the data now, so we'll be reporting on the findings of that next year. So that should be quite exciting. And we're right now actually conducting the next round of our mental health and wellbeing follow-up survey. So we did the original adult survey back in 2016, 2017. That was a big survey with 4,000 participants. We then followed up that survey in 2019, 2020, just on the Morwell cohort, and that we'll be reporting on that in a sec. But we're now doing a second follow-up of that adult survey. So that really gives us 3 points of time to follow people's wellbeing. Interestingly, the last one happened to be during the Black Summer fires. So useful time, but perhaps not the best time to ask people how they're responding to Hazelwood. This survey is happening now and will be completed before the end of the year so that we get people, when there's no other smoke events, there might be flood events, but no other smoke events, prompting their responses. So again, we'll be reporting on that next year. So these two batches of findings, and I'll give you a little bit more details in the subsequent slides, are actually from that 2019-2020 survey. And in this case, we've done quite a number of papers from that. These are the ones in the last year, and they're relating to patterns of psychological distress that are still apparent over time, and also the relationship between reporting of physical symptoms and psychological distress. So this graph basically gives you an image of the different types of response patterns that people might have. So you can have someone, and this is across the different time points. So the orangey bar is the mindfire. The first grey bar is our first survey in 2016, 2017. And the next bar is the follow-up survey. And in a year's time, we'll have another bar for the next survey. And basically, you've got people's patterns of distress. So people who didn't report distress at the first survey and still weren't reporting distress at the second survey, which is where we want the majority of the community. They're the resilient trajectory, and as you can see, we've got almost 80% of the community in that trajectory. Then there are some people who had delayed onset, where they actually didn't report it in the first instance, but then reported it in the second instance. And in truth, that's possibly due to the effect of the Black Summer fires, which is why we think these results are interesting. There are people who are in recovery who may have reported it in the first instance, but then by the time of the second survey, it's dropped off. And then there are people who are reporting it at both time points. They're the ones we're most concerned about because they've got ongoing and persistent distress. And so what the analysis is doing, I won't go into a lot of detail here, but it's trying to identify the different risk factors for those groups, and in particular for those who show chronic distress or delayed onset distress. We can see that they're more likely to have less social support or be more lonely. They may have reported prior traumas in their lifetime, so they're major significant traumas at any point in their life, or recent stressful events like conducting a community briefing in the last year, physical health or mental health diagnoses and so on. So we can identify some of the risk factors which we think are going to be clinically useful so that when events like this happen, people can look for those sorts of factors and try and find the groups to support. Now, I don't expect you to be able to read this slide. The main point here, again, this is using the same data and looking at levels of distress, and in fact, 2 different sorts of distress. The blue bars are distress associated with the mine fire, and this is 6 years on from the mine fire, people are still reporting distress that's associated with that event in 2014. The green bars are just in the last month, have you been experiencing distress? That's the Kessler 10-item distress level. And what this is actually tagged against is reporting of 15 general physical symptoms. So that's various pain, so pain in limbs, back pain, headaches and so on, diarrhoea, shortness of breath, stomach pain and so on. And the take-home message from this slide is that almost every single one of those green and blue bars is on the other side of the dashed line. So what that means is there's a significant relationship between both forms of distress and each of these symptoms, with the exception of mental problems, which would a smaller set, as you suggest, and it's because there's overlap between the surveys, because that's actually tagged in there. So what that's telling us is that there is a clear relationship between people turning up with these obscure pains that they don't have a particular reason for, and potentially post-traumatic stress, because these are measures of stress following the mine fire. And so what that's saying is that when you're dealing with a community that is responding to an event, and you turn up to a GP or whatever, and someone says, look, I've had this back pain, which was me in the last week, then why do you want to obviously look at physical causes and isolate those? It's also worth thinking, wait a minute, this is post an event. I really should also wonder whether this is evidence of post-traumatic stress, and consider screening for that as well. So we don't know what the answer is, but we know that clinically it's worthwhile looking for other reasons, not just the reason the person's turned up, because it could be it's to do with distress. So our future plans, as Sue mentioned, we're continuing to work with the community wellbeing stream to look at that link between individual and community wellbeing. And the survey that's running now has actually got a measure of community wellbeing. The survey that ran 2 years ago actually said, how do you feel about your community and how has it changed since the mine fire? So we're trying to track that, but we're also tagging it to things like individual distress and so on. So we'll be able to understand whether community wellbeing is the sum of all the individual wellbeings, or whether there's something else going on there. And as I say, we're about to start work on the health stream data that we've collected, and so we'll be talking about that next year, and the adult survey data that we're collecting right now. And there'll actually be another round of the health data in probably 2024 as well. So more data collection to come.